Okay, today I'm having a conversation with an old friend and Steve Lawler. Steve is currently the CEO of the North Carolina Healthcare Association. When I first met him about 10 years ago, he was at Biden Healthcare, but in the last 3 years or so, he started with the North Carolina Healthcare Association. So I wanted to have Steve on today, ask him a little bit about what they do as an association, and more importantly, what is he hearing from his membership. So Steve, thanks for doing this. And
Oh, my pleasure. Thanks for inviting me.
And so, kind of give us a little, a capsule, if you will, of what you guys do for your membership, and also what are you hearing from them right now with the COVID pandemic?
Sure. Well, thanks. I really appreciate the chance just to connect and see an old friend, even if is not in person. I think one of the things we're all learning how to do is to kind of do our normal business routine and then maintain relationships in a very different way. Yeah, so our association, we've got 130 members. So every hospital and health system in North Carolina, is part of our organization. And I think a good way to think about what we've been doing is if you think about fighting a war and, essentially, those folks that are privileged to take care of patients and take care of communities, they're on our front line. They're the ones that are kind of waging this battle against the pandemic. So our job is we're kind of like the support structure behind them. In many cases, we're doing things like working with the federal government on waivers, working with the state on waivers to make it easier for them to do their work. We're working with the federal government, our elected officials at the federal level, trying to craft support packages that creates much needed cash flow into their organization so they can continue to be relevant and care for their communities. Same thing at the state. And then we are spending a significant amount of time and energy being this kind of a virtual shared services company where, we've got a landing page for the gray market for supply chain. I didn't think that I would be running a supply chain operation anymore. But have become a great resource for our members in regards to just running down supplies. We do weekly calls with our members. We have a variety of different affinity groups that are going on, sharing information. But it's such a privilege just to be in a position to serve them and care for them as they fight for their patients and community during these really extraordinary times.
So, why don't you describe a little bit about the financial impact that no elective surgeries and some of those, just kind of a feel for that.
Yeah. So like other hospitals in other states, I mean, our members, when, we started having positive cases in North Carolina, were asked essentially to change their business model. So, the governor asked if we would stop non-essential services and elective cases. So hospitals and health systems kind of pivoted, stopped doing that particular book of business. So for small community hospitals, that's like 80% of everything that they do. For these big tertiary care academic centers, still a pretty big chunk. But so they changed their business model, hardened the sharp end where patients are coming in and where we would be expecting to take care of a surge. And then they just hunkered down. And, in some cases we had hospitals and health systems develop SWAT teams to go into nursing homes that were infected. In many cases, they're picking up public health responsibility. But when we change that business model, what it's costing North Carolina hospitals is a little over $1 billion a month. And that's a little over $800 million in lost revenue opportunity based on not doing those high-end services that pay the majority of the bills, and then adding another $200 million in new costs or more expensive carrying costs so that we're there for patients and community in the event of a surge. So, pretty significant financial impact. We are lobbying and advocating at the federal level and the state, to help make up some of that loss. The funding from the CARES Act and the subsequent bills that came out of Washington, essentially are covering a third of that. So, a pretty significant gap that we have to figure out how to make up over time. In North Carolina, we've had several hurricanes over the past 5 years. And what we find is it takes anywhere from 3 to 5 years for a community or a community hospital to recover after that kind of event.
So maybe then that leads me to the last question here. In the next 6-8 months, what do you see? What's your forecast for those, for those hospitals financially?
Yeah, so I mean, that's a good question. It kind of reminds me of the quote from the Rocky 3, because one of the things that we're all doing is we're binge watching all these old movies that we like. So I've got to watch the Rocky series. So, the prediction that Clubber Lang gives before the fight, when they ask him, "What's your prediction?" and he said, "My prediction is pain." That's going to be pretty painful, especially for community hospitals. I mean, folks that don't have a strong balance sheet are the ones that are going to be impacted the most. And in North Carolina, we've got 48 community hospitals. So we're the second largest rural state other than Texas when you look at, per capita and resources. So we're concerned about those 48 hospitals, and we're working now to develop game plans and playbooks for our hospitals to start resuming some of those essential services, which are key to their survival. What we're seeing is a second wave of patients. So these are patients that have put off surgery that are now having medical problems, or a third of the people with chronic problems have stopped going to the doctor. So those folks now are becoming sick and showing up and need essential care. So I think the next 18 months, it's going to be some hard work, and people will be making really tough decisions. And again, I think it's important to learn from these lessons. And I think a lesson learned for our elected officials is that if we want hospitals and health systems to fight this battle, then we've got to resource them appropriately to do so. So hopefully we'll have some thoughtful policy come out of Raleigh as well as Washington.
Well, we're in it together, and hopefully we can get out of this together really quickly. You're nice to do this again, Steve. I appreciate you doing this. I will probably ask you back at some point, because I'd be curious to see how we are in 3-4 months, how we're trending then. But
Sure.
you're nice to do this, and thank you so much, and it's great catching up.
Well, it's nice to see you, my friend.
Thank you so much.